What the heck is inflammation? You know, is that when your ankle gets swollen? Well, yeah, it is. But inflammation is primarily the body's response to things. Anything that initiates an inflammatory response in the body raises the cytokines that are associated with all of these diseases. Now, throughout our body, there are these little receptors. They're called toll-like receptors. And I don't expect everybody to even care about these right now. But research after research after research shows that now there's toll-like receptors throughout our body. Oral bacteria have been shown to turn those on. And when they're turned on, the body says, hey, I have a problem. I need to go ahead and help fight that. The problem is the fighting of that is inflammation. Inflammation is part of our healing process. And when we turn on that little fire, we're sending it throughout our body. And when we have a constant source of it, oh my gosh, that's where people get very much into the pathways of inflammatory disease. I'm talking about the day in and day out, 24-hour-a-day flow of bad things from the mouth throughout the body. Think of inflammation as exactly what inflamed sounds like. It's fire, it's hot. When you get hot, things get messed up. So look at it this way. Our body is like a house, and the mouth is like the kitchen. And where do most fires start in a house? They always start in the kitchen. And this is our little manufacturer of inflammation. So when fires start in the kitchen or in the mouth, most of the time they end up burning down the house. So who cares about inflammation? Everybody. Everybody in healthcare is worried about inflammation. The perfect feed for them, and it's being done across the country, is us dental professionals helping them reduce inflammation. We have this very important area that is a little engine of inflammation, and that spreads throughout the body, and it often causes different locations to have problems. Cardiovascular disease, the 12 inches of blood vessels around the heart. There's all kinds of problems with the knees. My buddy Garth Ehrlich from the Center for Genomic Studies has great research on oral bacteria showing up in knees and how that is very involved with not only rheumatoid arthritis, but also the degeneration of the knees and the replacement of the knees. That's oral bacteria, kids. The pancreas, pancreatic cancer, elevated risk there. And then when you think of how the effects of the mouth and diabetes are so interconnected, my gosh, it all is there in front of us. It's just a matter of us getting rid of the big source of inflammation. It reminds me of a quote I heard just the other day by a patient of mine. It was perfect. And he just out of nowhere said, hey doc, I'm really not as interested in that back tooth as you are, but I'm sure worried about my health, and anything you can do for me is going to just move right up the level of importance in my eyes. And when you add systems into your practice to help them with their overall health, you put yourself in a much better position just for your own practice. This is going to be just utilizing what's available, putting it all together, understanding how the pieces fit together, and then the simple action plans that will show you just if this, do that, that's the outcome, remeasure, change it a little bit if you need to, but it's real simple. And when you do advanced periodontal therapy, you reduce inflammation. That is the key to the kingdom in my mind. And that is the way we are going to save lives extraordinarily in each and every one of our practices.